Let's just talk real quickly before we end. What are some of the safety concerns with this sensitive class of opioid?
As was mentioned earlier, these medications are very potent. If you take that, a lot of these patients, not necessarily everyone, are quite debilitated by the disease itself. They're quite often elderly. They are not necessarily immune to a coexisting disease. So you really, the concerns are the excessive sedation with respiratory suppression. Obviously, as with any opioid, the concern is with constipation. So these patients who are sedated, and let's say you start them on a too high of a dose of a short-acting medication, they can stand up from, let's say, sitting or horizontal position, fall and break their fragile bones or a hip or something like that, which can lead to really disastrous complications. So these are the most common concerns that are on the top of my list when I assess a patient and determine the dose.
Great. You know, having reviewed the pharmacokinetics of each one of these TERF or rapid onset products, they're pretty close. They're a rapid rise to plasma levels, and assumably that's why we get rapid onset of analgesia. What do we tell patients as far as safe use of these products? What do we tell them, Jerry, what do you tell your patients about storage or disposal?
Storage is, in some of our homes, having done a lot of home nursing in storage, we talk a lot about lock boxes and keeping the medicines away from children, not driving while these are being used, at least initially until the physician clears the patient for driving. Oh, and then pets. We tell them, you know, don't let your pet get what's left over.
Of course. Great. So